Professor Coimbra, can this Apnoe-Test be lethal for the potential donor?
Yes. First of all, I would like to make crystal clear that several patients that are now currently selected for the diagnosis of brain death, they could be recovered to normal daily life if they were not submitted to Apnoe-Test and they were given timely, updated, proper treatment. So this is something very important, and I would like to make that crystal clear. In other words, by performing those tests for brain death, those so-called diagnostic tests for brain death, we are killing patients to make sure that they are dead, which is nonsense. So this is the first statement that I would like to make crystal clear, as I said. And why am I saying that? We have to go back to 1968 when brain death, the concept of brain death, was introduced into medical practice. Back to 1968, physicians, medical doctors used to think that when we had no detectable neurological functions which is performed by the brain, the only possible explanation would be irreversible intracranial circulatory arrest. And why would this circulatory arrest occur? The reason why there is a lack of brain circulation in a patient who is a victim of brain trauma, head trauma, is because after the injury, the brain begins to swollen. And as the volume of the brain increases, the pressure into the skull increases too. So that as time goes by, the intracranial vessels that are supplying blood to the brain are compressed by this increased pressure. And back in 1968, we used to think that when all those so-called cephalic reflexes were like pupillary reflex to large, for example, when all those reflexes were no longer detectable, the only possible explanation is that the intracranial pressure had reached maximal values. That means that the blood vessels within the intracranial cavity were completely compressed, and there were no blood flow to the brain. So they associated the lack of function to necrosis, to irreversible damage to the brain tissue. Lack of function, no vitality. Okay? Mm-hmm. That's the concept, the pathophysiological concept that was proposed in 1968 to select the criteria to diagnose brain death. Mm-hmm. Okay, but later on, the progress of medical science demonstrated that when the blood flow is decreased to only half the normal level, those reflexes can no longer be detected, but the brain is still recoverable at this point. within the range of 20 to 50% of brain blood flow, of the normal brain blood flow, the brain is functionally silent, but it's still recoverable.
Mm-hmm.
Okay, if you induce the Apnoe-Test, that means that you will stop mechanical ventilation in order to increase the carbon dioxide concentration in the blood. Mm-hmm. When you do that, you cause what we call in medicine a sudden respiratory acidosis. And that means that there will be a negative effect on the strength of heartbeats. In other words, the patient will develop hypotension, and this is known to occur in up to 40% of patients that are submitted to Apnoe-Test. If you induce hypertension, you will decrease the blood circulation. Mm-hmm. And if the patient was having blood levels to the brain within that range of 20 to 50% of the normal level, and you decrease the blood pressure, the blood flow will go down to the range of below the level of 20%, and that means that you can induce irreversible brain damage by performing the Apnoe-Test. In addition to that, if you are decreasing the blood flow to the brain, you are also decreasing the blood flow to the respiratory centers. Those centers are the structures that you are testing when you do the Apnoe-Test. You want to know whether the brainstem, the respiratory centers in the brainstem, will respond to increases in carbon dioxide concentrations. But if you decrease the blood pressure, you will be decreasing the blood flow to respiratory centers, mm-hmm. and the respiratory center will not respond to Apnoe-Test. And you can damage the respiratory centers irreversibly. You can irreversibly damage the respiratory centers by inducing apnea in these patients. It should be clear that the Apnoe-Test may last up to 10 minutes. A patient can be without proper respiration, mechanical respiration, for up to 10 minutes. Mm-hmm. And this may kill the patient. And that's why I'm saying that when we are testing those patients for brain death, we are killing them. We are killing an unknown number of those patients. Some of those patients may have irreversible brain damage prior to those tests, but a large number of them may be recoverable up to that point. And when you induce a Apnoe-Test in those patients that up to that point could be recovered, they are no longer recovered.